So my name is Kartik Shah. I'm our toxicologist and one of our emergency medicine physicians, and I work at the Northeast Georgia Health System. It's interesting when you look at the Hippocratic Oath that even before patient care, you actually talk about teaching. And so that's part of our duty is to help train the next generation. But I think teaching is also important that it reminds me of the process that I went through, that seeing when something clicks in a learner's eyes and it makes you happy, and just, you're happy that you're training them as well. And so I think it's really cool seeing that, and that's why I enjoy being a faculty member.
I'm Catherine West. I am the Associate Program Director of the Emergency Medicine Residency. The reason why we started a program is that Northeast Georgia really is an ideal training environment for emergency medicine. We have a really great community and a really great hospital that supports our emergency department, our residents, but we also have an ideal training environment because of our patients. We have an incredibly diverse patient population. In terms of the acuity, we see incredibly sick patients every single day in the Gainesville Emergency Department. It's an incredibly busy place to train, which is great because that means when you graduate on day one, you're ready to take care of patients independently. You've seen so many different things in residency that you know how to take care of it because you've seen it before. And so I wouldn't ever start a residency program if I didn't feel like we didn't have that kind of diverse, busy hospital system in order to train our residents. So one of those things is that we are a level 1 trauma center, which we got level 1 trauma center verification about a year ago, which doesn't mean we changed much from being a level 2, but it just kind of demonstrates that we are already providing level 1 trauma services to our community.
I'm Spencer Masowitz. I am Emergency Medicine Core Faculty here at Northeast Georgia Health System. I'm also the EMS Medical Director for our hospital system, as well as the Region 2 EMS Medical Director. Yeah, there's almost too much to talk about in terms of EMS electives and opportunities. Certainly we have the full plethora, the full gamut of options here available to the residents should they choose to pursue them. Certainly there are minimum standards for all emergency medicine residents coming through their residency as it pertains to EMS. We start as little as ride-alongs that they will complete with Hall County Fire, and soon either White County and Barrow County will be involved in that ride-along program. But additionally, we have options to immerse yourself in technical rescue, high-angle ropes rescue, hazmat scenarios, mass casualty disaster scenarios, upcoming sports medicine opportunities / event medicine. Additionally, we have flight opportunities with one of our regional partners. And we're currently in the process of building a physician response vehicle which will allow residents to either on their own or with me ride along and engage pre-hospital providers and 911 callers directly in the field.
I'm Anita Matthew. I'm one of the partners in GEDS, and I'm also the APD for our residency program. So we think that independent groups are really the way to practice in emergency medicine, and so we think that's the way to go. We encourage our residents to learn about our own group, and we talk about CMGs, but we also talk about the advantages of owning your own group and really having a ownership in your group.
My name is Hersha Patel. I'm one of the emergency medicine faculty. I'm the director of pediatric emergency medicine and kind of function to, within GME, make sure that our residents get a good pediatric experience. So one of the biggest things that we have focused on is, as an emergency department, is our pediatric readiness and making sure that we have all of the equipment, all of the supplies, all of the education required to take care of children in our emergency department. So we use something called the Pediatric Readiness Score, which basically identifies us as being able to take care of children in an emergency setting. So we've increased our pediatric readiness score by twofold in the last 3 years, which basically has kind of a direct correlation in terms of childhood mortality and morbidity, and making sure that we can take care of anything that comes into the emergency department from a pediatric standpoint.
My name is Dr. Jordan Dow. I am Director of Emergency Medicine Ultrasound Education, and I am one of the core faculty here at Northeast Georgia Medical Center's Emergency Medicine Residency. I am fellowship trained in emergency medicine ultrasound, and both in my emergency medicine residency as well as in the fellowship worked to integrate trauma-informed care at the bedside. And so when it comes to the clinical experience, that means trying to understand that all of our patients come with trauma, and that us as clinicians, it's our job to make sure that we both recognize that trauma, try to set up an environment that is mindful of that, and avoid re-traumatization. And as an emergency medicine ultrasound fellow, I try to bring that to the bedside ultrasound as well. So as we are looking inside of people's bodies and providing them with knowledge, we want to also make sure we're mindful of all the experiences that they come to the department with.